Hello everyone, welcome to my channel Capsa. In the previous video tutorial, I have discussed about what are the risk factors, what is pathophysiology of rheumatoid arthritis. In this video tutorial, I will discuss about sign and symptoms, what are the diagnosis procedure available for rheumatoid arthritis, what are the treatments. So looking at the first sign and symptoms is morning stiffness. What do you understand by morning stiffness? When you feel restricted movement or stiffness, first wake up after sleeping. That is morning stiffness, which will obviously last for 30 minutes to 1 hour. Obviously. Second one is fatigue. Fatigue means refers to extreme tiredness or weakness. Third one is fever if there is any infection. Fourth one is joint swelling and tenderness. Swelling means accumulation of fluid and tenderness here refers to pain, also known as Arthralgia. Fifth one is anemia and the sixth one is anorexia. What do you understand by anorexia? Anorexia means simply loss of appetite. Okay. Now, what are the diagnoses? So, rheumatoid arthritis is very much difficult to diagnose in the early stage, because in the early stage the sign and symptoms mimics any other kind of disease, okay, like systemic lupus erythematosus. These disease actually mimic the rheumatoid arthritic disease, okay. So diagnosis is only possible in the latter stage, and it is based on three types. First one is physical examination, second one is laboratory test, third one is your radiographic findings or imaging test. Now in physical examination, first you need to consider symmetrical joint swelling. It means left and right hand, same finger will be affected, same joints of the finger will be affected. This is symmetrical joint swelling. Second picture represents rheumatoid nodules. You can see the common site for rheumatoid nodules, and this picture represents the rheumatoid nodules of the hands. Okay. In the third picture represents rheumatoid vasculitis. What do you understand by vasculitis? When your blood vessels get damaged and there is blockage of oxygen supply, it looks like this. In the early stage, this picture represents the early stage and this picture represents the latter stage. Okay. Now what are the laboratory tests? So these are common laboratory tests which are performed. First one is CBC count. What is the full form? Complete blood count, which shows if there is present of any kind of mild anemia associated with rheumatoid arthritis. Second one is CMP, means comprehensive metabolic panel test, which actually measures 14 different substances to check your body's chemical balance and metabolism, like glucose level, albumin, sodium, potassium, bicarbonate, alkaline phosphatase, alanine transaminase, aspartate transaminase, bilirubin, etc. Third one is RF test or rheumatoid factor test. If there is a presence of RF antibody, this test actually measures the amount of RF antibody present. Fourth one is anti-CCP antibody test. It means antibodies to citrullinated peptides. This test actually looks for the presence of cyclic citrullinated antibodies if there is presence of CCP. Okay. Fifth one is ESR test. ESR full form is erythrocyte sedimentation rate, which measures if there is any inflammation in your body. It means if there is high ESR rate, it will represent active disease, presence of active disease. And CRP test is means C reactive protein. This protein actually found in your liver, which then circulates in your bloodstream. And this test measure if there is any inflammation, presence of inflammation. Okay, and if CRP level is high, then obviously there is active disease. Okay, so these are the common laboratory tests performed. Now third one is radiographic findings or imaging test like X-ray, MRI, etc. Okay, you can see the X-ray images here. Now treatment, which kind of treatments are available? You should keep in mind that there is no cure or no specific treatment available for rheumatoid arthritis. Only to help the patient or to cure the symptoms, medication is the first choice. So in the medications, first is NSAIDs, steroids, DMARDs, these can be given. Okay. Second one is therapy. First one is stretching therapy and second one is physiotherapy or physical therapy can be provided. Third one is surgery like synovectomy or joint replacement. Synovectomy is the surgery of synovial tissue or synovial lining, or to remove the synovial tissue lining, synovectomy is performed. Okay, so this is the end of my lecture. If you liked the video, please do like, comment, share and subscribe. Thank you for your attention.